Thank you. Thanks very much indeed, Dido. And I think a beautiful setup for what I'm going to talk about today. So thank you very much for the invitation to come and speak today. My name's Natalie Banner. I lead an initiative called Understanding Patient Data, which is hosted at the Wellcome Trust. Our aim is to try and make the way that patient data is used more visible, more understandable, and more trustworthy. So that combines both trying to find ways to talk about data in ways that don't actually send people to sleep, trying to make it understandable because it's a very technical, jargon-filled space, and more trustworthy, which I think speaks to what Ara and Andrew and Dido have all spoken about. So what I'm going to talk to you today about are some initial top-level findings from a piece of work we've been conducting over the past year, which is a really detailed, deliberative public engagement on what constitutes fair partnerships for using NHS data. And we've set this up very deliberately to feed into the developing Office for Life Sciences policy framework, but I'm also hoping it can be very, very helpful for the health data hubs as they're beginning to think about what should these agreements look like in practice in a way that is conducive to public trust. The paper isn't published yet. We're still finalising some of the data analysis, so I can only present the top-level findings today, but I hope they will be sufficient to really generate some interesting and really concrete, tangible discussion about what it is that the public expects and wants of the way NHS might engage with academics, with charities, with industry when it comes to the use of data. So we set up this public engagement deliberative work to do several things. We wanted to explore public views and values in relation to the use of patient data, but also operational data. We thought both of those things were important to understand. We took a very deliberate approach of not asking people, should this stuff happen in the first place, but switching to a more systems-level thinking. If these agreements are going to happen, how should we do this in a way that is going to be conducive to trust? How can we ensure that these partnerships and these agreements are set up in the right way? And that had the implication of shifting people beyond thinking, what often happens in this space of, I want individual control, I want to give consent to all of these things. We shifted people very deliberately to thinking about the system level. How should these systems be designed? As I mentioned, we wanted to feed into the developing policy framework and help the health data hubs really understand in a concrete way something about public expectations, views, and values. We took a very deliberate mixed methods approach. It started off with some patient roundtables, working with some fantastic patient advocacy groups who already had some good insight and understanding about the kind of data environment. So we weren't starting from kind of first principles and this is what the NHS looks like, this is what patient data is. We started with some groups that had a good understanding of the space and worked with them to really hone questions and the sorts of case study materials that we could use. We also have a fantastic oversight group, some of whom are here today, so thank you very much for all of your input, to really try and ensure that what we were presenting was fair, was impartial, and was balanced. We didn't want this to be lip service or a fig leaf for trying to persuade people that everything is brilliant about the way that data is used. We're very conscious of trying to ensure a very fair and impartial process. We then conducted 3 citizens' juries with our social research partners, Hopkins Van Mill, that included 60 people in total. These citizens' juries, the idea behind a citizens' jury is it's a longer format than something like a workshop. We had 2.5 days with these participants to really help them explore, understand what data is, how it can be used for purposes beyond their own care, what the different models might be for that. They had opportunities to ask questions. We had insights from expert witnesses. And the idea behind those juries is that they eventually come up with recommendations to the system, to the policymakers, to those who are managing and in control and in charge of data. So they had these recommendations. Drawing from those citizens' juries, we then undertook a national online survey. Now, it's really difficult to do quantitative work in this space because if you ask someone a question like, would you be happy for pharmaceutical industry to use your data? Then you're going to get a fairly predictable response. It's really difficult to actually just ask questions when people have no context and don't have the opportunity to ask their own questions. So we tried to frame those questions in ways that drew on the key themes that were coming from the juries and provide a little bit more quantitative substantiation to some of the things that had emerged from that jury process. We started off with an exploration of fairness. And the reason for that was we were really trying to get people to think about the trade-offs, how you might weigh up benefits, risks, things that you didn't know, how you can possibly create and manage these partnerships between NHS, academia, industry, charities, and so on in a way that was fair. We didn't sort of go specifically into public interest and public benefit because we thought that actually the concept of fairness would allow people to explore quite a wide range of issues and questions, but around that sort of theme of, you know, what seems like a reasonable sort of value exchange back and forth and so on. We were very much embedded in case studies. We used case studies involving patient data and operational data. We also tried to sort of think more into the future with some of those examples. And we drew on expert witnesses from a really broad range. We had industry representatives, those from NHS Digital and the system. We had HDR UK's Public Advisory Board, you know, people from charities, think tanks who've done a lot of work in this. Also privacy groups as well. We felt it very important to ensure we had a really balanced perspective on this. And thanks to the Imperial work from Sarah and from Ara's team as well, we explored actual specific models. Once the participants had understood a lot more about the system and the context, we actually said to them, right, so here are some different potential models of value exchange, partnerships, access agreements, and so on that could be, in principle, agreed by the NHS and possible partners. And we sort of bucketed these in three kinds of categories. The sort of simple monetary exchange on the one hand, something a bit more system-wide benefits, or future potential, so looking at things like equity, profit share, what sort of products could be developed down the line that could then sort of channel value back to the NHS. So we explored all those, and people had lots of views, it's fair to say. As I mentioned, this is pre-publication, so very much top line. The data analysis is in the sort of final process at the moment. But I think some key themes emerge that the citizens' juries and the surveys actually resonated quite closely, which I think was fantastic. Some really unsurprising. Low awareness. There continues to be low awareness in the fact that the NHS could use data for anything other than your own care. And I think has already been mentioned, you know, some frustration that it's not even used for your own care at the moment very well. But there's a lot of interest in this. Once you start the conversation, people are really fascinated and want to know more. There is recognition of the potential value and benefits. People can get very excited about the fact that there's this huge potential, as Andrew talked about. But there are lots of concerns. The NHS just isn't set up for this stuff. And we had lots of examples where people were talking about information not being shared and still using paper records or having to fax things. And, you know, people saying, well, look, you're talking about this really whizzy high-tech stuff, but we're not getting the basics right. So are you sure the NHS can do this? It's a fragmented, complex system. We're slightly skeptical about whether you can realistically realise all these benefits. The benefits to patients absolutely matters at the heart of everything. If you can bring that value and that benefit back to patients, that is hugely important. But something that came through that possibly we hadn't sort of seeded and we weren't necessarily expecting was a real worry about exacerbating health inequalities. So if you're investing time and energy and infrastructure in certain areas that have the capacity to curate their data well, to work with researchers, to generate some of these partnerships, what happens to the hospital down the road that maybe doesn't have this capacity and this infrastructure and this ability to invest? Are we accidentally going to make things worse regionally because we're investing a lot of time and energy and money into data in some regions? And, you know, particularly if you're developing things like algorithms, if you're using data from a certain population, then is the algorithm you develop going to not apply to different populations in other areas or not going to be as accurate and as fair? So that risk of exacerbating inequalities came through very strongly. Dido talked about sort of the complexity of the system, and that's something that resonated very strongly. Once particularly in the citizens' juries, people understood the NHS was not a single thing. There's lots of talk about the NHS as though it was a single entity, and of course it's not. And once they understood that, they said, this is very complicated. We would like there to be something more simple, more straightforward that applies across the board, so that wherever you are in the system and if you move around it, the same rules apply. We can know that if data is used in this way, in this environment, and there are certain rules around its structure, that is also going to apply elsewhere. They wanted there to be some unitary single governance, even if it's implemented slightly differently in different areas. There was strong enthusiasm for citizens to actually be involved in the governance and decision-making. And that doesn't necessarily mean every single decision that is made about what these partnerships, about specific partnerships, on each and individual level, but involvement in the decisions about how these things should be run, how these partnerships should be set up, how you can trade off risks and benefits and weigh up what the potential is. There was strong enthusiasm for there to be more citizen engagement and involvement. And I think this speaks to the point about public trust quite a lot. We talk a lot about the need to build trust and earn trust, but I don't think we're trusting the public, actually, with this information. We're not trusting them enough to be able to engage with this stuff and provide what can be incredibly insightful, valuable opinions coming at it from outside the system. A lot of the questions they raised were really, really on point. And I think we need to do more to think about how we can trust citizens to engage with these processes and provide their insights and inputs. And finally, I think probably a fairly unsurprising finding, we need much more communication and transparency in practice. And as Dido said, if you think you're being transparent, you've probably only just begun. So there is huge amounts of optimism, which is good to know. Once we explained and talked to people about what the potential might be and the way that data could potentially be used to deliver new benefits to patients, improve the health system and so on, there was a lot of optimism. People thought, wow, this is exciting stuff. This is really cutting edge. Focused on those improved health outcomes and those benefits back to patients. Enthusiasm for sort of the idea of sharing knowledge and creating more of a system-wide ecosystem rather than individual things happening in particular regions or places that don't sort of roll out to the rest of the system. Lots of enthusiasm for the idea of there being efficiency savings and increasing revenue for the NHS. A lot of people talked about, look, the NHS is in trouble. You know, it's under a huge amount of financial strain. Could this be a mechanism through which we can help improve efficiency and actually help the NHS potentially earn some more money from the data that it has? And enthusiasm for the kind of leadership and reputational role of the UK. Again, particularly in a kind of post-Brexit world, can the UK really be a leader in this space, both in the data innovation, but also doing it in a way that's trustworthy? Of course, optimism is also balanced out to some degree by caution. People are concerned about data security. That is unsurprising. There's lots of talk about, risks and breaches where data might be used, either misused or through negligence or through some other data security breach or cyber attacks. Lots of concern that those things could happen. Worries about the additional bureaucracy that this might create, particularly given the complexity of the system. Strong message to keep it simple. Don't overcomplicate what is already quite a complicated system, partly because it makes it much harder then to explain to people what's happening in practice and what the rules of the game are. There were some really insightful comments about, what's the impact if we don't have accurate data? If data is inaccurate, if there's potential for bias, what does that mean for the sorts of products we might develop? Could they end up actually causing harm because we haven't properly understood some of the features of the data quality, and whether it might in and of itself have sort of biases within it? And also financial and reputational risks. If the NHS is going to, say, invest in a company or have a share in a company that's developing an algorithm, does that skew the incentives towards the financial rather than thinking about the patient benefit? Or would you continue to use an algorithm that you'd invested in even if something else better came along because you have that financial investment? And of course, reputational risks if things go wrong. Of course, things will go wrong. That is inevitable. So, lots of concern about reputational risks to NHS organisations if there are, whether it's breaches or products are developed that then are quickly outdated, or there's new products that are better. So all of this, I think, points towards some real challenges for developing policy in this space. The NHS organisations, it's a system, it's complex. And there is a really strong desire for keeping it simple when it comes to these partnership models and these agreements. How do you manage that? I think that's one challenge. Secondly, I think a healthy degree of skepticism, actually, about realising the benefits in practice. There's a strong sense of, look, you're talking about all these fantastic innovations, and it all sounds great in principle, but I still can't get my prescription delivered to my local pharmacy, or I still have to repeat myself 5 different times if I go and see a specialist. You really think you can pull this off? And I think that's a fair challenge. That's certainly a fair challenge back. The idea of value in the data is perceived only through tangible outcomes. And I think this is a real challenge when it comes to things like the plumbing, data curation, for example. I think everyone here would probably think, you know what, would be really great if we could invest in really high quality curated data. That in and of itself is not a good sell, as it were. The tangible outcomes and the benefits are the things that people get excited about. And if you're just going to talk about having a fabulous data set, that is probably not going to excite people other than the data scientists who might be really thrilled about having high quality data. So unless you can link it to those outcomes, it doesn't feel very tangible to people. As I mentioned, there is this strong desire for citizen involvement in oversight and governance, and I think it's a real challenge for us to work out what that looks like in practice. Does it mean citizens on decision-making committees? Does it mean citizens being involved in individual sort of access agreements and partnerships? Does it mean citizens being involved in setting out the principles and the rules of the game that apply across the system? Does it mean citizens being involved in actually the other side, in the data use side, working with the industry partners and working with those who are actually wanting to develop tools and products to say, well, what are the problems we have that we think data might be able to solve? And actually sort of not just being about the governance side, but the tools that are actually being developed in the first place. And I think a final challenge is around future-proofing and sustainability. While there was a lot of interest in ensuring there was a sort of system-wide governance framework, a lot of people also thought about, well, what does this mean for our children and the future of the system? How do we build something now, especially given how rapidly technology is developing? And I think Andrew's picture of the gigantic home computer is very pertinent here. A lot of people thinking about, if this technology is developing so quickly, how can we anticipate whether the rules that we are trying to put into place now are going to be future-proof, are going to enable sustainability of the system? And that came through strongly, certainly in the juries. So that's just my overview, very quick overview of the key findings. We're hoping to be able to publish the report in February, but in the meantime, that should be hopefully plenty of food for thought in terms of thinking about how we actually embed and involve citizens in the process for developing these partnerships. Thanks very much.